sign. Somebody get my SOS in time. So are you with me? I need a squad through thick and thin. I gotta rely on you, no matter what tragedy I'm in. Forever allies, together we rise, no matter how high we can climb. 'Cause we're standing on our shoulders, tall as giants. Or else we'd just be falling like trees with no one around. Raise our voices together, or we won't make a sound. Lift me up and I'll lift you straight to the sky. Back me up and I'll have your back till we die. 'Cause we're a team. Come together with me. Be what we wanna be. Unstoppable now 'cause we're a team. We'll get you back up, no matter what force knocks you down. You got to have your family on the front lines, or else we just be falling like trees with no one around. Raise our voices together, or we won't make a sound. Lift me up and I'll lift you straight to the sky. Back me up and I'll have your back till we die. 'Cause we're a team. Come together with me. Trees making beautiful sounds. Raise our voice like a choir for miles around. Lift me up and I'll lift you straight to the sky. Back me up and I'll have your back till we die. 'Cause we're a team. Falling like trees making beautiful sounds. Raise a voice like a choir for miles around. Lift me up, I'll lift you straight to the sky. Back me up, I'll have your back till we die. 'Cause we're a team. We got this. We're a team.
And I'll have your back till we die. We got this.
Happy New Year, NuPath. It's me, Dan, and welcome to NuPath Live, the first NuPath Live of 2022. I hope everyone had a great New Year's celebration, and I hope you enjoyed the retrospective that we shared with all of you. I want to tip my hat to Greg Morris for putting a lot of that together, and I don't know, I just was really struck by the dimension of all the people we talked to and all the things that we went through in 2021. And you know, I was thinking about it on New Year's Eve. I heard a lot of people talking about what a crappy year 2021 was. And some people even comparing it to 2020. And in my mind, those two things it's not even close. In 2020, at the end of that, I was just so ready for that year to be over. And we hadn't even had the vaccine at that point. I mean, there was genuine, real fear every time many of us left to go to a grocery store or anything, thinking, you know, if you're somebody that's got pre-existing conditions like moi, you get COVID-19 and you're not vaccinated, that could be it, you know. And 2021, it wasn't what we expected it to be, and that's like one of the biggest complaints about it. We were all set to go, you know. We were back to better. We were opening big. We were going to have our annual walk in October and have the first in-person event and really started to get ourselves worked up and excited. And then the Delta variant hit, and it just sent everything down the toilet, it felt like. And I know there's been a lot of a lot of consternation. It's almost impossible not to catch some of it just from listening to the news about Omicron and how many new cases there are and hospitals being filled and trying to understand what the CDC's recommendations mean for us and I'm sure there's all of us know multiples of people that have tested positive in far more than ever we experienced during the heart of the lockdown and the pandemic. At least that's the case for me. Um, Many of our own NuPath staff have tested positive. Some key people, uh, some people that have had it before, and some people that have gotten it for the first time. In short, it's something that we're all experiencing, and some of the hysteria and the anxiety and the certainty, it's bound to cloud things for us. This morning we had our monthly business meeting. Well, we didn't really have it. What we did was we were going to cancel it because there's so many people that have tested positive, so many people that are sick. We were already short staffed due to the workforce crisis and our just struggles we have had with recruiting quality candidates for positions. And so then add on top of that people that are testing positive, and we felt that people really could probably use the flexibility to do other things if they needed to get coverage for their programs and so on. And yet I didn't want to cancel, so we thought let's call it a listening session. Let's invite people to just join us and just kind of share those snapshots of where they are. And it really helped me. It was good to hear directly from so many people and just some of their challenges in their programs. And if you're a family member watching this and you have somebody living in our residential programs, I'm sure none of this is news to you guys. I'm sure it's demanded all kinds of patience and having realistic expectations. As we've had some shifts that have been very short, and hats off to Doreen and Michelle. I mean, those guys are amazing, and all the residential managers. I mean, it's just incredible to think how they're able to balance everything, and maybe sometimes it feels like barely so. And I know it seems like I'm rambling right now, but it's kind of where we all are in our headspace, and I think that just maybe acknowledging it and saying that it's okay to feel the way that we're feeling, and that we're right to be feeling. I'm gonna have Greg pull up the. I did a couple of slides I was going to share with you. You didn't have to stare at my face the whole time. Oh yeah, happy 2022. I guess I said it last week, but this time I really do think 2022 is going to be better. We're so much further along than we were. But what I was going to share with you, but so my dad is English, and I grew up on the Pooh Bear and Christopher Robin's, children's books. And so I'm always kind of drawn to them, and maybe during times of, looking for comfort in some way or something. But this is kind of a meme on the story. It's Pooh, yeah, Piglet, I'm tired of all this. I am too, Piglet, says Pooh. I am too. And then there's a more modern twist for a little bit more crude. 6 feet, Piglet, back the bleep up. And to me, I was thinking it's kind of like how the dichotomy of all of this is, that on the one hand we're feeling a kind of almost exhaustion and just sort of this existential kind of weariness in our bones, and on the other hand we're kind of a little sharp and prickly. And we've been talking about pandemic fatigue in a way. The definition is really relates to when you get so tired of following all the restrictions and regulations and everything that maybe you just stop practicing with that kind of discipline, and then it makes it more likely to catch it. I think it also involves much more, and Matt Johnson shared with the group this morning. He's going to talk to us a little bit this afternoon. And he has just some really good, solid, not, as he said, they weren't groundbreaking suggestions, but they were really great. But so the pandemic fatigue, this burnout that we're trying to really, be aware of and acknowledge. 76% of U.S. employees are currently experiencing some form of workers' burnout. 57% connect that directly to COVID, and 33%, and I'm surprised it's not higher. Talk about the political unrest in this country right now, and the angsty, and what's today, January 6th. Let's not pretend that we don't know what that's the anniversary of, and so this kind of, outside of NuPath, because I feel like in NuPath we're pretty much on the same page, and we've got each other's back, but it doesn't feel that way always in the larger population. And then on mental health, we know the experts tell us to care for our mental health. 78% of the workforce believe that COVID-19, no kidding, has negatively affected their mental health. 85% say that their issues, and I can't read the print; it's too small. Blame say it's affected their physical health negatively. 68% of people would prefer. Oh, they prefer to talk to a robot than their manager. Well, I hope it's not my direct reports that are saying that, but I know people just don't want to mess with any bull crap. And 76% of workers believe that their company should be doing more. And this is where we want to. We got to take care of our people at all levels of the organization. It's harder to recruit people. That we know. That we've been talking about since April or something of last year. But we cannot risk losing any of the good people that we have. I just want to, if I haven't said it already, I'm going to say it again. If you're a family member watching, we appreciate your patience. And if you've seen little blips and there's areas that maybe we're not getting quite right, and if it's something that's not an urgent health or safety, we appreciate your patience, because we're all trying very hard. Poor Eeyore, it's okay to not be okay. Yeah, maybe sometimes it is. Some days are just harder than others, he says. And then, with a more of a little snarky reimagination, all I need right now is a hug and $500,000 in cash. We can't give you $500,000 in cash, but we sure are trying to take care of all of those workers that are working in our homes that have positive cases through various incentive programs or overtime and the like, and doing whatever we can to get through this thing. The good news is that most experts say that we should be out of this in a couple of weeks, so it's not like we're going to be dealing with this level of infection. And by the way, Matt may have the statistics. We've seen a definite increase in the cases of COVID. I think there were 10 or 11 positive cases on Tuesday when we tested, and they're doing testing today, and we'll know more for the weekend. And then we're getting it in other sources, but so we're seeing an increase consistent with what is being experienced across the nation and in various enclaves. But the most important thing is, out of all the people, the 10 or 11 that we had this last testing cycle, nobody's ended up in the hospital. Nobody's died, knock wood. People have had symptoms, but those that have been vaxxed, and we all are now, and soon, hopefully, we'll be all boosted. They're not ending up in the hospital, and that's the key thing. If it weren't for the 5 days of quarantining yourself, then people would probably, in some cases, could come back to work even sooner. Which is something that is another thing that adds to the fatigue, is the confusion, the changing, guidance. We expect there to be new developments and new variants and things that come along that might change our routines or what we'd come to know or think about it. But a lot of that's just part of living through this experience that none of us have ever been through before. So why am I talking about all this? I guess I just want to recognize, as we start into this year, just recognize that things are tough right now. And I know our staff are just doing the best that they can. And again, just want to, I feel like I thank people a lot, but there can never be too much thanks for the staff that show up every day. Before we go to Matt, I just thought I'd take a minute to read and email, or I think it was actually a Facebook post. I don't do Facebook regularly, so I'm not the best for that, but Brett is good about sharing things with me. This is from Deborah, who's a mother I met over the summer. We were out at the dunk tank, I believe Brett said. And I'm just going to read it. It says, NuPath staff, administrators, clinicians, and all support personnel have risen above expectations in these difficult and dire times. I love the way she includes all of the divisions. Nobody's left out there. That's really thoughtful. We don't know what we would have done without you and your programs. You adapted, adjusted, and pulled together to support your clientele. We had 15 very long months of no programming for our daughter other than Zoom, but accommodations were then made for her particular needs. She leaves the house exuberant. Oh, that is just music to my soul. Exuberant to attend and arrives home very happy after being well cared for and engaged. Thanks to all. Hats off to all. Deborah, thank you. Thank you. I shared that text with, well, that post with everybody that I thought would listen to me, and now I'm doing it at NuPath Live. And we get this kinds of feedback about our staff and the job that they continue to do weekly. And so I know that it's not just my bias and my particular bent and affection for NuPath employees, but that it's true that our people care and are doing everything they can. And even though there are so many things happening across the organization and people that are dealing with, personal issues and struggling with, various treatments and maybe illness, people in their lives that are ill or having lost family members this past year, we're all still engaged and we're marching in the right direction. I believe that, and I know that we're going to get through this. It's just a matter of a short time, and we'll be on. And does that mean it's the last time that something's going to happen? No, there's maybe another variant, another two, another three. I don't know. I don't know what 2022 has in store, but I do know that we always figure it out. We always do. We got this. All right. Well, you call that a monologue? I don't know. I just wanted to share just a little bit what was in my head, and as we think about asking Matt's going to share with us some ideas for coping with some of this stuff, it's just a time to stop, pause, acknowledge this is tough, this is hard. We're dealing with a lot of things to keep people safe, to keep shifts staffed, all of it, and but we got this together. All right, let us see if we can coax Matt into coming on now, and we'll talk to him and see what he has to say.
Hi, Dan. How are you?
There you are. So you have somehow become, well, first let me say welcome to NuPath Live. And typically, I think we'll forego the formalities. I always like to comment that you've raised X, like, I don't think maybe it's 12,000. I can't remember off the top of my head. We've done it several times. You've been part of the Club 50, like every year that it's been in existence, and
Yes.
and a key contributor on top of being just so good at your job and so dedicated to NuPath. Somehow you have found yourself in the role of our own sort of, would you call yourself a Dr. Fauci, like, for NuPath? I don't know if it would really fall that category. I know you're not a doctor, but we have come to really rely on you for your assistance around some of the logistics. You were right at the heart of our response to getting the first vaccine clinics. And I know you'll be talking to us about boosters when we really need to start to pay more attention to that, and also at the kind of a heart of the testing and how we're complying with all the guidance and the requirements. Where are we right now in the middle of this crazy surge that we're experiencing just after the holidays?
Yeah, we definitely are in a surge. We're having a spike in COVID cases, just like I think the rest of the country and definitely Massachusetts. Over the past week, we have seen an increase, and we've had 2 rounds of testing that came out at about 15% positivity rate and then 6.5% positivity rate. So a little under the Massachusetts current rate of about 21%. It's a challenge. It certainly is a challenge. It is, put us in a different status where we are having to cover shifts where staff have to be out. It's changed the face of our day programs in a sense because so many people are staying home as well. So it is a different time. Prior to this past week, though, we have done really well as an agency. Our monthly positivity rates in September were like 0.6%. And then in December, we were at just over 1%. So we've done really well. This spike, though, is certainly been a challenge.
Now everybody's, wringing their hands and freaking out, and it's almost hard to, it's like an upcoming, like the snowstorm that's predicted for tomorrow morning, for example, where people are just like, you almost get freaked out by listening to the news, by hearing, the more you hear about people, the more the cases, more the beds are filled. But the fact is what? Nobody that's gotten it from NuPath, tested positive, has ended up in the hospital,
Yep.
has died, has become gravely ill. There's been some discomfort
Yeah.
in cases.
Yeah, I think that's very accurate. We've had no hospitalizations and no one with very severe symptoms. People have had pretty significant symptoms, but most people have been very mild cases to no symptoms. The things we really do know is that while the cases are up, they're actually mild in comparison to the COVID of 2020 and early 2021. The number of hospitalizations are up, but we do hear from the news that those aren't as severe, that the people in the hospital are not having a severe reaction or cases. We do know vaccinations are working. Clearly, your vaccination status is tied to your symptoms. We clearly hear that the people who are in the hospital are the people that are unvaccinated, and the people with more severe symptoms are unvaccinated. So, here at NuPath, we have a vaccine mandate. Everyone is vaccinated, all of our employees, and almost everyone, is in the process of getting the booster as well. I think, everyone has in that process of protecting themselves. So, it's a really good place to be, that we know when we do get cases, they are very unlikely to be severe.
Mm-hmm, mm-hmm. And the reason why we know all these cases, often we find out, is because of the mandatory testing. The average person in the population is not getting tested like we're getting tested. Our staff are getting tested twice. Is it twice a week or once a week? Everybody
Once
has
a
to,
week.
to do it. But we're hoping that the CDC, that the regulations are going to continue to change as we understand this Omicron a little bit better and understand. I mean, already the changes are significant. Before we go on and talk about strategies for dealing with this whole, fatigue thing, we don't have any plans to close our programs at this point. If you're a family member out there wondering, oh my God, is NuPath going to close down? And I know that there have been other organizations, other agencies that have closed day programs. They've closed their day hab, for weeks at a stretch if they've had a spike. That's not our intention at this point in time, right? We're trying to keep programs open, whatever we can do.
Yeah, that is not our intention. We provide an important service to the people that come to us during the day, and that's something we plan to have open. We've taken significant precautions, and we're certainly monitoring the test results and helping the people we support maintain safety and sanitation as well, and wear masks. So we're doing all the precautions that we can, but we have no intentions of closing the programs at this time. And our virtual programming is up and running as well. So that is an option for people if they are at home and they want to get connected with NuPath. They can get on the virtual programming every day. It starts at 10 o'clock.
Mm-hmm. Mm-hmm. Yeah, and I'm glad that's continued for people. So you shared with us this morning, we had a business meeting, and people at NuPath Live have heard me talk about it probably because it's the first Thursday of every month. So that means one Thursday a month. We've done that in the morning, and then we come on and do NuPath Live in the afternoon. And sometimes there's some commonalities. And today we were talking with our group, just checking in with them, just to give them a chance to talk, to listen, to hear their frustrations, the things they're dealing with, because we're all embattled with so many different competing, sorts of distractions and demands. We heard from people whose spouse was a was a nurse, and just how their lives have been so. And you shared with us some nice thoughts on just common sense in some cases, but you had a nice presentation. You want to share with the group, anybody listening that may be feeling some of this pandemic fatigue, COVID fatigue, just sick to death of all of it, and what could help us?
Yeah, I think, first and foremost, I would, hope that people would admit and identify that COVID fatigue is real. It certainly is a real phenomenon that we're dealing with. It is something that all of us are experiencing in our own way, some more severe than others. You know, really, it is that kind of buildup of emotional exhaustion and stress that comes from the constant exposure to the COVID demands and the COVID discussions and talk and experiences that we all have. Recently, I had a family member that tested positive. She was very upset about it. She was anxious, crying, very nervous about the outcome, about the impact she might have had on her friends and significant others. And it was hard because I started that conversation of there's a lot of stress and anxiety, and amongst the tears, it was, this isn't stress and anxiety, this is real.
Yeah.
And it took some discussion to really work through that
Can you just say it was your daughter?
I can't say it was my daughter.
When you shared that this morning, that meant so much to me to hear you share. And we heard several personal experiences because people are dealing with children, they're dealing with grown children, there's spouses, partners, all kinds of things, aging parents. I mean, life hasn't stopped on everything else that made life messy and hectic and confusing and sometimes hard and sad and all of that. It's still happening. It's just happening around COVID.
Yeah. And, it was hard for her to stop and just take a moment of okay, let's be grounded in what's real and what's really happening. And once she did that, it really helped. And I think, that's probably the thing I would suggest first and foremost is to take time to stop, reframe your thinking, rethink. Take a look at what the facts are around you, what the situation really is, and, what your status is, what's going on. I think sometimes we do get caught up, as you said, in the hectic nature of it and all the news and the conversations and kind of the hysteria at times of things. And we really need to stop and kind of rethink that. I had recently myself presented to someone, a coworker, about the new variant that's in France, and it has 46 mutations. And I kind of got myself worked up over it a little bit. And she was, she stopped and said, you know what, that's been around for a while. And, there isn't any evidence that it's spreading and that it's highly contagious. And it was reassuring to just kind of come back to the facts of that and, be able to just stop and take a deep breath and say, you know what, that is a little bit of hysteria going on. And then, there are a lot of strategies. There are a lot of things people can do to really limit some of the exposure to COVID fatigue. The unique part of COVID fatigue is that this is an ongoing stressor. It's been going on for almost 2 years. It is something that is, not fading. It's probably more intense right now for most people than it has been in a long time. And, how do we manage that? What are the things we do? I think our goal is to reduce our own stress and anxiety around it. And the first step might be to find times to take breaks from it, find times to get out of the COVID discussion, get away from the news, get away from all of that kind of hysteria that's being talked about, find times to connect with other people where you make it a rule that you're not going to have those conversations, that COVID is not going to be part of this discussion. So what else is going on, and what, friendly conversations and connections can you have? Is it, touching base with a faith-based organization that you have? Is it friends and family? Is it someone you don't see regularly, but you can give a phone call to and have a conversation with? Taking that time to break away from it is important. Sometimes during the workday, that can be important as well. We at NuPath, and I'm sure in many other places, we don't have the opportunity to avoid COVID. We have lots of new responsibilities, lots of new stuff going on that we need to be responsible for. And, there are a variety of conversations that need to happen. We can't leave those and ignore them, but we can find times to connect with the other important things at NuPath that we do, the things that bring us here that we all love and cherish, and that, sometimes feed our own souls and really make us, happy about why we're here. Find time to do those things and leave COVID to the side for a moment. For generally living healthy, don't let this period of time block you from living healthy. Physical activity, physical exercise is a very important part of not only our physical health, but lots of research shows the mental health and how that physical exercise and activity can really support positive mental health. Find time to do that, whether it's at your own pace. Is it a walk? Is it jogging? Is it lifting weights? Is it just getting up from your seat if you have an office job and you're at the seat all day? Find ways to do that. Eating healthy, sleeping well, those are important things, and they're not easy to do. I would certainly say that is hard for all of us, but as you find ways to set those sleep schedules, to find ways to make better food for yourself and eat healthy, those are important pieces. Gratitude, we talk about this every November, and gratitude is certainly a very important piece of, having that kind of emotional health. Like, what is it that I'm thankful for? What are the things around me that are important to me that I'm thankful for? That can really help you build some positive framework and a positive attitude about the things around you.
Unfortunately, we're out of time because I probably went on too long at the beginning. But when we were there today, what was struck by is knowing that we're all so committed to doing our jobs and leaning on each other, trusting one another to get through this thing. Because no matter what, Matt, we've worked together, going on 18, 19 years?
Yes.
We'll get through all of it. Thank you so much for taking the time to come on today and for sharing some of those helpful tips. And yeah, we got this. I know we do. All right. We'll talk to you later. Thanks so much, Matt. All right, everybody. We went a little long today, but we'll see you next week. We got this. Talk to you soon. Bye-bye.